everyone. Good morning. My name is Hazelle Palmer. My pronouns are she and her, and I am the president and CEO of Sherbourne Health. Sherbourne Health is often described as a dynamic organization. We offer integrated health services, and that includes primary care through our family health team and acute care through our acute respite care program. We offer a wide range of community health programs and capacity building initiatives, all of which enable people and communities to move along the care continuum towards good health and wellness. Thank you so much for joining us today. This year, Sherbourne Health is marking an important milestone, 20 years of operation, serving 2S LGBTQ communities, people who are underhoused or experiencing homelessness, and newcomers to Canada. Rainbow Health Ontario, which is one of our programs here at Sherbourne Health, was formed in 2008 and focuses on creating opportunities for the healthcare system to better serve 2S LGBTQ communities. We do this through several initiatives, including training for healthcare providers across the province to be more clinically and culturally competent in caring for their 2S LGBTQ service users, supporting system change by producing evidence-based print and online resources, contributing to a 2S LGBTQ health perspective on public policy processes, and acting as a research catalyst, as well as hosting events focused on 2S LGBTQ health. It is such an honor and privilege for me today to invite the Honourable Marci Ien, Minister for Women and Gender Equality and Youth, to share an important announcement supporting sexual and reproductive health services for 2S LGBTQ communities across Canada. Minister Ien, welcome. Thank you.
Hazelle, I just want to thank you so much, you and your team here at Sherbourne, for the important work that you're doing. It is work that you are leading with such empathy and such care, and want you to know how much I appreciate that, how much we appreciate that. Hello, everyone. Bonjour. Bonjour à tous. Before I begin, I would like to acknowledge that we are gathered here today on the traditional territory of the Mississaugas of the Credit First Nation, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I want to thank Sherbourne Health again for hosting this event in this fantastic community health hub. It's beautiful. I want to talk today about access to safe sexual and reproductive health services. And this is something that affects us every day, in every city, and in every country. Countries around the world grapple with the issue of access to reproductive health care, and the information surrounding it, that disaggregated data that I like so much, the numbers, is really scarce. Unfortunately, barriers continue to exist, and we know that finance and travel resources are a huge, huge limitation for many communities. And across the country, some have had a hard time accessing the services that they need. Accessing them in a culturally safe, that's important, and stigma-free way. But our government has been really, really clear on this. These services and resources should be available to everyone in Canada. And I want to underscore that, everyone. So this is why we're here today, because this is what's so important. We've seen the pandemic. We've seen how it worsened the gaps. There's a lot of lessons to be learned from the pandemic. Who was left behind? Who wasn't getting the care that they needed? The gaps worsened in sexual and reproductive health care, stretching limited resources and forcing many organizations to make really, really tough decisions. Other factors, including stigma, including discrimination, lack of specialized training, that's important, the empathy that I talked about, travel restrictions, and the closure of reproductive services, limit access to quality sexual and reproductive health care. And we know that this is particularly true for the LGBTQ2 communities, who are often unable to access sexual and reproductive health services because of a lack of safety in healthcare. Are people safe where they go? A lack of safety in healthcare settings, a lack of knowledge about LGBTQ2 health. We saw that gap. We knew it existed. It was exacerbated during the pandemic, and it is why we remain committed to supporting organizations across the country to improve access to sexual and reproductive health services. Because we know that frontline work, right here and beyond, plays an important role in addressing these barriers experienced by LGBTQ2 communities. Frontline work. People day in and day out, serving community with compassion, serving community with care, and in particular the LGBTQ2 community, which needs a whole lot of care now more than ever. So today, I am thrilled to announce on behalf of Minister Duclos that Health Canada is investing more than $5.1 million for 4 national projects. They are led by the Community-Based Research Centre, the Canadian Centre for Gender and Sexual Diversity, Egal Canada, and Sherbourne Health, 4 of them across the country. Please indulge me while I highlight this for you, because the projects are amazing. So just a few Coles notes, if I might add, on each of the 4. The Community-Based Research Centres project will involve 3 main activities: capacity building, which is so important for service providers, the development of sexual and reproductive health leadership programs, as well as the creation of health promotion resources for LGBTQ2 communities and healthcare providers. And then the Canadian Centre for Gender and Sexual Diversities project will develop and deliver educational resources, training, teaching, tools related to LGBTQ2 inclusive sexual health education to help teachers, as well as health and social service providers, increase their capacity to support members of those communities so that they have the tools that they need to help. Egal Canada's project has 2 pieces, and here's what they are. The first is to develop training for healthcare providers, training people. This training will help providers work towards patient-oriented care, because patients come first. For intersex infants, children and their parents, as well as guardians. And then the second piece focuses on peer support and resources for intersex individuals. What do they need? How do they need it? For parents as well, and guardians, because families are impacted. Families need support of intersex infants and children. And then Sherbourne Health's project will develop, pilot, and promote peer-reviewed, important, evidence-based, really important, resources for healthcare providers about sexual and reproductive health services for LGBTQ2 individuals. The project will focus on family planning. It will focus on pregnancy considerations. It will focus on parenthood. It will focus on postpartum and newborn care, as well as general sexual health and wellness for LGBTQ community members. These are incredible, folks. This is incredible work. These are the projects that are especially needed as we emerge from the pandemic. Talked about the gaps, talked about who was left behind, talked about our government seeing those gaps and addressing those gaps, and that's why we're here today. It's about taking a really good, hard look at how we build on and improve health outcomes, which is why training is a huge aspect in all 4 of these projects. This also includes our government's belief in the inherent right of individuals to make informed choices about their own health, to make informed choices about their own bodies. So finally, I would like to close by saying this. All Canadians, no matter their circumstances, should have access to a full suite of sexual and reproductive health care. Not one person left behind. That includes everyone, regardless of their sexual or gender identity. Everyone. I am more than confident that the projects announced today and the amazing people that are part of them, I've used the word empathy before, but it's important because the work happens on the ground. It happens on a day-to-day basis, and I am confident that these projects led by these amazing people, including many members of the LGBTQ2 community, is going to get this work done and is going to get this work done well. At this point, I'd like to introduce Carolina Bernstein. Carolina is the Senior Director of Community Health and Capacity Building Initiatives at Sherbourne. So great to have you here.
Good morning, everyone, and thank you, Minister Ien. Thank you for being with us today at Sherbourne Health to announce this important funding. Sherbourne Health has long been a leader in 2S LGBTQ healthcare. From individual care through our family health team to system change through Rainbow Health Ontario, much of our work has been in response to a lack of resources and knowledge that can create barriers to care and barriers to healthy communities. Thanks to this funding from the Government of Canada, Sherbourne Health can be part of creating and sharing knowledge with healthcare providers to increase awareness and build clinical skills to provide quality sexual and reproductive health care to 2S LGBTQ communities. Our new program, Improving the Quality and Access of Sexual and Reproductive Health Care for 2S LGBTQ people living in Canada, will help to build towards a future where more midwives, physicians, nurses, nurse practitioners, and allied care providers better understand the reproductive and sexual health concerns of 2S LGBTQ people. And when people are seen, understood, and provided with expert care, we can all thrive. This funding will also help us expand our reach outside of Ontario and provide vital skills and knowledge to providers across Canada. Thank you. Thank you.
Thank you, Carolina, and thank you, Minister Ien, for this very exciting announcement. And I just want to also congratulate the other recipients of the funding. I know it's going to make a tremendous difference. And thank all of you for coming this morning. I think we turn it now to some questions, if there are any questions from our journalists.
Yes, we will now take questions from the floor. Please say your name and outlet, who you are directing your questions to. One question, one follow-up.
Hi, Minister Ien. Christina from CP24 CTV News. How are you? A question actually unrelated to this on behalf of my colleagues in the network, as you have just been appointed as the new co-chair of a task force to deal with these passport and immigration issues. What can be done in the short term to clear the lines and provide relief? I know that we are currently reporting this 48-hour speed up for people who need to travel right away. But this has been an ongoing issue, and it seems quite clear it's a staffing issue. So maybe if you could speak to what can be done in the short term and why a task force is necessary.
Christine, it's good to see you, and thank you so much for the question. It's an important question. It's my privilege to be the co-chair of the committee with Mark Miller, the Minister for Indigenous Services. We have gotten right to work on this, and we have been working on this, but this is an all-of-government, all-of-cabinet approach. What I'd like to do is kind of pull the curtain back a little bit and to explain to people how our government, how our cabinet works, just a little bit. We are a team and a cohesive team. We see Canadians where they are. We see people where they are, and these are huge issues. I've seen the pictures too. I've talked to people in my constituency office and my team. I represent Toronto Centre. Immigration is a huge, huge part of how we serve the people in Toronto Centre, as our passports, as our, the situations in our airports. But we are here as a team. We are here, and you talked about short term, Christina. That's what this is about. Coming together to take care of this. Understand what's happening. You know that I'm research-based. You know that. Former reporter's cap on right now. And so it is looking at everything, speaking to people, and understanding how we can quickly address this. We've been working on it, but clearly there's more to be done. We're not hiding from anything. We are working together to do this. Our teams have already started the work. We didn't waste any time, that's for sure. The press release came out a couple of days ago, and the expanded work happened then and continues to happen.
And Minister, since you said your team has hit the ground running, in your initial assessment, what's the problem and what's the timeline for a solution?
We are hearing from the ministers that have been in charge of these files first, because I think, when it comes to research-based and it comes to listening, it's what are you seeing, what is happening with regards to immigration, airports, what is happening when it comes to passports. Tell us, and then we take that information and we go. So that process is happening right now. It started. And so I'm happy to get back to you on that.
A timeline for completion for this task force?
I don't know
Or
about
report back?
I don't know about completion, but I would be a very happy camper, and I know my colleagues would be, if we had something tangible in the next several weeks.
Any further questions from the floor? I will now pass to the Zoom conference for any further questions online.
Thank you. We will now proceed to questions from journalists online on Zoom. If you're a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and your media outlet before asking your question. Nous allons maintenant prendre des questions des journalistes sur Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf si je l'ai dit, veuillez identifier votre nom et votre métier avant de poser votre question. Alors, on va prendre notre première question de Jacques Galland.
Hi, good morning, Minister. My first question is about the LGBTQ action plan. Wondering if you can provide an update on when the government intends to actually deliver it.
Hi, who am I speaking to?
Hi, Jacques Gallant at the Toronto Star.
Hi, John. It's nice to hear you. And yes, this is something that we haven't stopped working on. We are still in the process, because I really do believe that this is important work. And what that means, as evidenced by what we see here today, it means that we are connecting with organizations on the ground, John. It means that we are listening to members of the LGBTQ2 community, including the 2SL community, as to what they need. I see this through an intersectional lens, John, because it's the only way that I see things. As a Black woman standing here, and what that means is, are things culturally appropriate with regards to the action plan? Are they appropriate for those living outside of urban centers, rural centers? Are they appropriate for seniors in the LGBTQ community? And what that means is consulting and talking to, and believe me, I am, and my team is, to everybody that would be impacted for what will be the first ever LGBTQ2 action plan that this country has ever seen. We need to get it right. I was so pleased that Budget 2022 included this to the tune of $100 million, but I will reiterate, we need to get it right. And that means talking to those who are part of the community, allies, and in every aspect, in every corner of this country, to make sure that we get it right. So you will see it soon. In the days ahead, you'll see it, but John, it has to be right. And I know I've said that 20 times, 30 times, but it does, because it is important. And I would also say that it is and will be evergreen, John. So constantly changing, because we're constantly listening to what people need. So do we need to tweak? Do we need to address something else? This is not going to be something that is one and done. This is going to be something that is evergreen, that we can add to while we consult and listen to everybody we need to. But thank you so much for the question.
Jeff, do you have a follow-up?
Yeah, thanks. As a follow-up to Christina's question on the task force, going into this, what is your understanding of the cause or causes for the delays that we're seeing with the passports?
John, this is about listening first. That's how I operate. I get the facts, I listen, and then I act, and my co-chair is the same. We need to and want to meet Canadians where they are. And we've seen the lineups. We've been part of the lineups. We've seen the different issues, but it is about accessing and understanding the information, which we're doing, and then acting on that. And I'm pleased to follow up with you stage by stage, which I will do as we work through this. But want Canadians to know that we are there for them, we are there with them, and we will get to the bottom of this.
Thank you, Minister. Our next question will be from Erica Ibrahim from the Canadian Press.
Oh, sorry. Good morning, Minister. Good to be connected with you this morning. My question is about the funding announcement today. I was wondering if you could confirm whether the funding comes from the $45 million the government pledged in its 2021 budget. I'm just curious if it's from that pot of money.
Erica, thanks so much for the question, and I believe it is.
Okay, thank you so much. I'm curious then if you can help me understand why this announcement's being made today. I know that by the start of 2022, 16 million from the fund was projected to be spent according to last year's budget. I'm curious about the timing of today's announcement.
It's always a good day, isn't it, to make announcements like this? I was so excited about this, Erica. It's always a good day. I mean, here's the thing. We are 2 days outside of the Pride Parade and Pride Week in Toronto, but I'm the minister responsible for women and gender equality in youth, and that means that the LGBTQ2 Secretariat is under my purview, under my team's purview. I can also tell you that this is Pride season, and so there will be a lot of announcements like this. I have Pride in Charlottetown in a couple weeks. I've got Pride in Montreal. I've got Pride in Vancouver. I've got Pride celebrations right across this country. And we thought, what an exciting announcement to make here at Sherbourne Health, because it's Pride season.
Do you have a follow-up, Erica?
No, that's everything. Thank you.
Thank you so much, Erica.
Thank you, Minister. So that concludes the questions from Zoom. I will turn it over to the room.
This concludes today's announcement. Thank you.
Thank you.